Imagine you were drugged, cut wide open and possibly killed just for the sake of science. Would you enjoy that? Probably not. Well, this is the fate of countless animals who are being tortured just for our benefit. Here with us today is Benjamin Ineichen with his second occurrence on the podcast. He's also an expert about multiple sclerosis. If you want to watch the video, click the link down below. But today he's an expert for animal experimenting. So stay tuned. So with our first question, how come you ended up in the research field of animal experimentation?
Yeah, so my story actually goes that my mother got diagnosed with multiple sclerosis, and then I did a PhD. And back then I had the belief that, you know, as long as we find a new therapy for a disease, it doesn't matter how many animals we use to develop such a therapy. But I had to learn, I mean, this is my personal learning from my PhD, where I worked with rats and mice and also monkeys in part. And we did like quite severe experiments with these animals. And this was relatively heavy for me. And this brought me to this whole field of the goal that I want to contribute to a better welfare of experimental animals in research.
So you had like an empathetic connection to these animals you were testing.
Yes, and I actually maybe I should say this, but I did a major error during my PhD. I worked with these rats, and I took home some of these rats, like the rats who dropped out from the experiments. I took home, and this was a very bad idea because like you can even more relate to these animals afterwards.
Mm-hmm. Yeah. Mm-hmm. Mm-hmm. So if you had a button to stop all experimenting on animals, would you press it?
So how would this button look like?
Like a red button.
Like how big would it be?
This, wait.
Yeah.
This big.
Yeah, I mean, it would be very tempting, of course. Like pushing a big red button is very tempting. But overall, I would probably not push it. No, because it's just not black and white. And I think we nowadays still need animal experiments in research. I think it's an important part of how knowledge is created still today. Mm-hmm. I hope there is a future where this is not anymore the case, but I think these days we still need animal experiments.
And how do the rules of animal experiments look like? For example, if I go to a labor with you, can I just take out the mice and do whatever I want, or how do the rules look like?
In Switzerland?
Animals? In Switzerland,
yes. Yeah. So by law, it is prohibited to run animal experiments, but you can get an exemption. Oh. So you have to submit you need an ethical approval basically to conduct animal experiments, and you have to write a very detailed protocol about your planned studies, and you have to justify why do you need animals in your experiments, and you have to do a harm-benefit analysis. So you have to weigh the potential benefits of your research. So what insights would we get? Would we find a new treatment against potential harms, because these animals suffer under these experiments? And you have to outweigh these two things against each other and really discuss that thoroughly in this proposal you have to submit to the regulatory agencies.
I mean, sorry, bro. I mean, those rules make sense for me, but I don't know. Does it really? Is there someone that checks on that? Because I think if you have no one that maybe is there who controls it, maybe there are people that can do whatever they want with them.
You mean checks like what's actually happening in the laboratory?
Yes.
So yes, there is controls that is controlled, and actually, this is important. Switzerland is very strictly regulated. Mm-hmm. Like it is one of the most strict regulations in the whole world regarding the animal experiments and what is allowed, and the controls are really strict. So that there is a check for this. Yes.
And which animals are mostly used for the experiments?
Mostly rodents, mice mostly, followed by rats, I would say.
Okay.
But yeah, monkeys is I think it's just one institution these days in Switzerland who has
Are
monkeys.
they easier approved? Like I could imagine it's just closer to humans if you test on monkeys.
Yeah.
But probably could be a better research. But is mice easier to get because it's so far away and easily disregarded in our society as like not nice animals?
Yeah, no, it's a very good question. I wanted to say two things. First, it is easier to argue in a harm-benefit analysis to use mice because they're considered less sentient than a monkey who, as you say, is from its ancestors closer to us genetically. With that being said, the second thing, and with this is important, there is actually no formal evidence showing that using monkeys helps translating findings to humans. So I mean, genetically it's closer to humans, but also a banana is like 50% genetically identical with the human, and you wouldn't test a drug in a banana, right? But still, monkeys are close to humans, but there is no formal evidence that findings from monkeys are more relevant for humans. And I think that's an important distinction to make.
Oh, that's really interesting. Also, maybe cost a budget analysis. I mean, if you have monkeys, it's
These things play a role. Yes, definitely. Yeah.
you have to have a big habitat and
Exactly.
everything.
Exactly.
But
Yeah.
where do you get those animals from? For example, I mean, mice, okay, we have here in Switzerland, but monkeys? Where are they from?
So there is a whole industry behind this. Like companies who sell animals, basically. Janvier, Charles River, Harlan, these are like the big companies. And you can order mice, you can order rats from them. Also monkeys, some of them, they sell monkeys for research purposes. But also some labs have their own breedings. So you breed your own mice in your lab. That's also a possibility of getting these animals.
And what does a mice cost? Like, it's a weird question, but
Yeah. So this is important. We do purely vegetarian research these days. So I'm not involved in animal research anymore.
Oh.
So my knowledge might be outdated. But back when I did animal research up to 2016 or so, a rat cost about 120 francs and a mouse cost about 50 francs. It depends a bit because there is also transgenic mice, so genetically modified mice. These are more expensive because they require more work behind them. But that's like probably the range.
Okay.
So a monkey is maybe really expensive for a labor?
I've not been involved in ordering monkeys. I cannot tell how much it
sounds
costs,
weird.
but it certainly, I mean, it certainly requires much more like a better infrastructure and facilities behind it to keep and like distribute monkeys.
Okay. So if you had to bring it to the point, what would you say are the pros and the cons for animal experiments?
Yeah, it's a very, very interesting question. So we recently did a study where we looked at around 400 therapies, and all these therapies have been tested in animals. And for each of these therapies, we checked how far advanced did it in the development process. So tested in animals, but was it tested in humans as well? And did it obtain regulatory approval? So is it used in clinical practice, like does it have official approval? And we saw that, how much would you guess of the therapies tested in animals make it to regulatory official approval?
That would have been our next question, but I would say, I mean, it's really hard to say, but I would guess around 10-ish%, around that.
Yeah,
I'd say the same.
I would say the same. Yeah.
Yeah, it's a good guess. So we found 5%. So it's a very low number. So that means 19 of 20 drugs tested just drop out. They're tested, so to say, for no direct gain for human health. I mean, there might be indirect gains, but at least only 1 out of 20 is approved eventually. And you can frame this argument in both directions. You can say on one hand, oh, this is very inefficient. Why are we still developing drugs in animals? Because when only 1 out of 20 makes it, why don't we exchange this whole drug development pipeline by something else? First of all, we don't have something else. And second of all, you can also frame it the other way, because in these 5% of approved drugs, you have, for example, fingolimod. Fingolimod is a drug approved for multiple sclerosis. And as you might know from my lecture, that several million people around the world are affected by multiple sclerosis. And so one single drug can benefit millions of people, for example. And then we come back to this argument again. Okay, what's the benefit of this one drug, or what's the potential harm you do to the animals? Okay, and there is no one can give you an answer to that, but it's still the weighing these two arguments against each other, and that's the pros and the cons.
You said something about vegetarian testing. Are there any other possibilities to test pharmacological products in a way that is afterwards safe for humans to consume or to take in?
Outside of animals?
Yeah.
Yeah, so there is an active field. I'm involved in a couple of research projects where it's an active field of developing alternative methods, so-called NAMs, non-animal methods or new approach methodologies. And these are, for example, organoids. So you can have like little mini brains, for example. You can like culture them in a petri dish, in a culture dish, and have these little mini brains. And these are potential replacements for animal studies, but we are not there yet. But there is an active research field aiming for finding such alternative methods.
Yeah. I thought to myself, I mean, in the end, it's all a chemical reaction when we take a drug into our body, right? So is there a possibility that in the future we might simulate that with like ChatGPT or an AI?
Yeah, so you might have heard of digital twins. Digital twins is when you, based on your personal information about your disease history and whatnot, and all your idiosyncrasies, you build a digital twin of yourself, and you can simulate in this digital twin, like you say, for example, toxicology of a certain drug. But this is still an active research field, and we are regrettably not there yet of using these models to completely like replace animal testing. Yeah. But it's a good idea. Yeah.
If you had the chance to create a future where no animals had to suffer for medical experiments, how would this future look like? Or what would you change in some labors maybe outside of Switzerland?
To get to a point where we don't need animal experiments anymore.
Yes, or where we just, where we can reduce the suffering to a minimum.
So you might have heard that next year we will vote in Switzerland a national petition for banning animal experiments. And while I think we should vote against this, we need some tension in the field to push development for replacement strategies better. We need an even stronger movement for developing such alternative methods that we can replace animals. But it's actually, have you heard of the 3 Rs? Is this something you have are familiar with?
No.
Sooner or later you might hear of that. 3 R is called replacement, reduction, refinement. This has nothing to do with recycling, but it's replacement of animals, but also reduction of animal experiments. So replacing it with other methods, reduction of animal experiments, but also refining animal experiments in a sense that you can run animal experiments, but the animals suffer less. And I think we need more momentum in the community to really replace animal experiments, because science is a very conservative apparatus. And usually research groups will just use the methods they've always used because that's most convenient. I'm also like that. We're like being in our comfort zone. But if we had a world where we had to come up with a solution in the next 5 years, we just had to, and then animal experiments will be banned in the next 5 years, I'm sure we would find more efficient solutions for replacing animal experiments. But if there is no tension or no traction to do that for researchers, there will be no solutions, I think, and that's why we need this momentum.
And how long do you think realistically it will take until we have the solutions? In years, if you had to guess, what would you say?
My personal vision is that we should be there in 10 years.
We should.
Yes, we should be there.
You think we are there in?
Hofstadter's law. It's like always everything takes longer than you anticipate.
Yeah.
So maybe we're there in 20, but my vision is that we're there in 10.
We hope so.
In Berlin. Airport in Berlin.
But of course, I mean, this is a very difficult question to answer. This is
Yeah. So we already are coming, unfortunately, to an end. So I have one last question about research and stuff. If you had one argument to convince us to go into research, what would it be?
Oh, that's a very good question.
Potential two researchers you could convince here.
Us. So, are you considering having a research career?
I mean, I would like to split. I don't want to go full into research, but I don't want to go full into.
So combine it.
Yeah.
Clinician scientist, something like that. Yeah. Same for you?
Not that much.
So you're more the clinician.
More the clinician. Yes.
Okay. So, my argument would probably rather convince you than it would convince you.
Yeah.
That's okay.
One argument, or which for me, which is why I love research so much. It's very diverse.
Mm-hmm.
You have teaching, you supervise students, you mentor young researchers, you can inspire young researchers potentially. So it can give you a strong sense of purpose. And the second thing I would say is that science is very, very creative. So I'm sure you have asked yourselves many questions like, why is it how it is, or why is that disease coming from what's the pathomechanisms behind this disease? And research enables you to answer these questions.
Mm-hmm.
Yes.
That's a very good argument, solid.
Yes,
Yeah.
I think so.
Yeah. We are coming to
Wait
an
a
end.
minute.
Oh, okay. Yes.
I actually have 2 questions for you now.
Okay.
Yes. So, wait.
Oh, he's prepared.
Uno reverse card.
So first question, what is the end goal of your podcast?
The end goal.
Yes.
Oh, that's a difficult question. I think it started out as a kind of a passion for creating, but if I think about it, there is not a particular goal, but I just want to help people, and I just want to also give insight about the medical world and maybe motivate some others to study the same as me, because doctors and researchers is something we will always need.
Mm-hmm.
And it's always going to be a problem. And if we solve a problem, there's going to be a new problem. Yeah.
Okay.
Yes, I have the same reasons like David, and I would also say that, I mean, it's just a funny project, and
It brings you joy.
Yeah, it brings
Cool.
joy.
Yeah.
Yes, and so why not?
That's great. Yeah. I think please subscribe. That's really it's a great
Yes.
podcast. Because he will shave his hair, right?
Oh yeah.
Or does that count?
So about that, we actually did hit our goal because a friend of mine botted us with followers. So he bought us followers. Unfortunately, we had to delete them, but because it's bad for the algorithm, right? If you get bought followers, the algorithm gets it. Oh, he's buying followers because they're inactive accounts, right? So they don't interact with your
interesting.
content.
Okay.
So
I see.
Instagram takes you out of the context, because it would be easy to be an influencer, just make an investment of $1,000 and then you have hundred thousands of followers, and then you had a passive income, right? So they want to close it up.
Yeah, it makes sense.
But unfortunately, I still have to shave my head because we hit the goal, right? And we asked us. It's kind of a weird question, but would you be willing, like, to do the first cut of my hair? I mean, because my friend Sonny has the apparatus
Are you
in
serious?
the back.
Really?
Yes.
Yeah, it would be a pleasure. I think it would fit you very well. Yes.
Yeah, we check out the other video. We will do this first.
Stimmt der Angle?
Jo, jo. Moet je nog kratsen?
Ja, so ist gut.
Good. Are we ready? Okay.
Ready to rumble.
So, I have kind of a weird question to ask. Would you be willing to make like the first cut to shave my head, because we kind of reached our end goal because somebody bought us followers, but we had to delete them again, so we kind of didn't hit it, but it still counts, so it's kind of a rough situation. So I'm still gonna be shaving my head. Yes.
Yeah, it will be a great honor, and I think it would fit you very well.
Okay, thank you very much. Thank you very much. Yeah.
And I actually have a second question.
Yes.
So, and you have to be honest, what would be if you woke up tomorrow with 100,000 subscribers on the Med Scholars podcast? Would that change anything for you?
I think I would lie if it wouldn't change anything. I mean, it's such a big following that it could be effectively a career that you could make out of it. But I wouldn't quit medical school, because this podcast is also about medical school, so I'm kind of trapped. But I mean, I would for sure produce more content, because I know, okay, now actually people are watching my content, and I can really influence, and I can really also kind of teach something, or better said, the guests are going to be teaching something which they are going to profit of, right?
Yes, and also I think that is maybe also a goal of us, because we want to reach as many people as possible. So it would be cool if we wake up tomorrow and we have 1 million followers or even more.
10 million.
So subscribe.
10 million.
Yeah, for sure.
Yeah.
Cool.
Yeah.
Yeah. I hope you reach this goal.
Yeah.
We hope to, yeah.
We hope, yes. But yeah. Now, unfortunately, we are coming to an end. We really hope we could give you some insight about animal experimentation. And if you have any questions, ask them down below. We try to answer them. Maybe we can't, then we will make an email to Dr. Ineichen, and maybe he can, who knows. So if you have any requested topic of the medical world, then just ask us. We maybe will be willing to organize another event with somebody. And please click on the buttons down below, subscribe, like, and we wish you a healthy day. Thank you very much.